Very good morning, all friends. Before introduction of the first speaker, let me welcome all of you, and Dr. Manthan will introduce our first speaker.
Thank you so much, Dr. Dhruva, ma'am. Very warm welcome to every one of you. Very good morning to IMS Surat. To start with today's session, one of the quotes from Hippocrates that I would like to recite, that the greatest medicine of all is to teach people how not to do it. So in this modern medicine, we know the three pillars. That is, one is emphasizing prevention, followed by the patient education and the wellness for all of us. That is the main pillars of today's modern medicine. With that positive tone and for the proceedings, I would like to welcome today's first speaker, Dr. Anil Patel, who has done his MBBS from GMC Surat in 2003, followed by MD from MP Shah Medical College 2009, DNP Nephrology from Nadiad in 2012. He's a nephrologist at MPUH Nadiad from 2012 to 2014, and he's practicing in Surat since 10 years. He's practicing at Kidney Clinic, Ring Road and Adajan, and he has been attached with multiple hospitals which include United Green, BAPS, Mahavir and Universal. His main area of interest includes kidney transplant, dialysis and glomerular disorders. So the next 20 minutes to 30 minutes for Dr. Anil Patel, sir. Please welcome, sir.
Good morning, everyone. Good morning. It's always pleasure to talk among such august people. So this time I thought, let me talk about some new things which have started developing in the city. As Surat is evolving, services in Surat are also improving. And whenever patient has any problem, they comes to our primary care consultants, that all of you people, and they have a lot of questions in their mind. And as a primary doctor, we are obliged to answer to that questions. So I thought, why not to discuss these basic things about one of important treatment of kidney disease, that is the kidney transplant. Best treatment for a kidney patient, that is kidney transplant. So I thought, let's talk about, it's like FAQ, that is facts everybody should know. Because it doesn't look good when patient is asking, we are fumbling what to answer. So my basic aim of this talk was to familiarize to everyone about basic aspects of this kidney transplant. So this is to make it interesting, I have made it a case-based approach. So this is a 45-year male who is a salesman, who was having 3 months history of weakness and anorexia, and when he was investigated, creatinine was 12. He was hypertensive and diabetic since 5 years and doing salesman job, that is where it is difficult to manage his life, his health, and he developed this dreaded complication of this diabetes and hypertension, that is chronic kidney disease. And it was detected very late. So when his creatinine was 12, and then he was declared end-stage kidney disease. So his kidney is unlikely to improve. So what next? So what should be the option for this patient? He was 3 months, 12 creatinine, 3 months symptom, already declared diabetic kidney disease. So options are here. He has to be on dialysis lifelong, option of kidney transplant, other is medical management only on treatment, no dialysis, no transplant, and shift to alternate medicines like let's try Ayurveda, homeopathy, other pathies and everything. So which are the common question which first comes? Patient comes, these are the options. So he choose, let me go for medical management, dialysis to na karaય અને ટ્રાન્સપ્લાન્ટ ને એવું બધું તો હવે વાત બહુ સાચી લાગતી નથી. આ થાય કોમન, પહેલી વાર આવે ને, acceptance is not there for any disease. So he tried alternative medicines also, and within 1 month, his condition deteriorated. All systems started responding, and he was landed up in ICU in volume overload, and he was dialyzed. Then he was better in next 3 months. So as we put the patient on dialysis, his health improves over next 2 to 3 months. So now patients has acceptance કે ઓકે કિડનીનો પ્રોબ્લેમ તો છે ડાયાલિસિસ ચાલે છે, પણ હવે સેલ્સમેનની જોબ છે, ડાયાલિસિસ આપણે કરવા જવું પડે અઠવાડિયામાં 2 દિવસ કે 3 દિવસ, કેવી રીતે થાય? બટ ડાયાલિસિસના પૈસા આપવાના, નોકરી ધંધે જવાય નહીં, અને જોબ એવી છે તો વોટ ટુ ડુ વોટ? સો હી આસ્ક કે સાહેબ આમાંથી નીકળવાનો કંઈ રસ્તો ખરો કે ડાયાલિસિસ મારે ચાલુ જ રાખવું પડશે કે બીજો કોઈ ઓપ્શન? સો હિયર ઓપ્શન ઇઝ ડાયાલિસિસ ઓર કિડની ટ્રાન્સપ્લાન્ટ. સો હી ઇઝ આસ્કિંગ વેધર શુડ આઈ ગો ફોર કિડની ટ્રાન્સપ્લાન્ટ, કે ભાઈ અમને ડૉક્ટરે કીધું જ નેફ્રોલોજિસ્ટે કે ટ્રાન્સપ્લાન્ટ કરાવો, તો અમારે શું કરવું જોઈએ કે નહીં કરવું જોઈએ? કરું તો ફાયદા શું? અને વોટ ઇઝ ધ બેનિફિટ? વોટ વુડ બી માય લાઈફ સ્પાન ઇફ આઈ ગો ફોર ટ્રાન્સપ્લાન્ટ? સો ધીઝ આર ધ ક્વેશ્ચન્સ જે આવશે પેશન્ટને આ પૂછશે. So let us see one by one. So who requires kidney transplant? Those patients who are having kidney failure stage 5. Stage 5 is GFR less than 15 ml per minute per meter square body surface area. That lasts more than 3 months. Then we'll consider this is end stage kidney disease. So that is irreversible type of renal failure of stage 5 who requires transplant. Those patients who are already on dialysis, that is hemodialysis or peritoneal dialysis, they will require, so they are a candidate for kidney transplant. So 2 things are required, that is renal failure of stage 5, and it is irreversible. Many times due to some factors, kidneys may recover, some component of AKI might be there, so it is better to wait for 2 to 3 months. If within 3 months it doesn't recover, then it is clear that this is a chronic kidney disease stage 5, this is not going to recover. So if you see what is the difference of survival between the dialysis patient and kidney transplant patient, you see these are the graphs of 10 years. Kidney transplant survival up to 10 years, you can say up to 80% survival. But in dialysis, at 10 years, only 10% are surviving. So survival is better when patient receives kidney transplant rather than being on dialysis. So patient પૂછે કે dialysis ને transplant બેમાં કયું સારું? તો એમાં સારું kidney transplant. And this is the survival, overall graft survival, that is the kidney કેટલું ચાલે. So that is around 40% at, you can see it is 30 years સુધી. Average if you see 50% of patients 15 years. આ ગ્રાફમાં જોશો તો 50% of patient kidney survives up to 15 years. Overall patient survival, that is also good. So in dialysis, only 10 to 15% of normal kidney function it delivers, but in transplant, that gives up to 80 to 85% of normal kidney function. So it is almost near normal kidney function. So one thing is dialysis is not 100% replacement or adequate replacement of natural kidney, while kidney transplant is almost near natural kidney function. Then dialysis patient have to be on strict diet, strict restriction to life also, because if they are on dialysis 3 times a week, if they want to travel or something, it is difficult. They have to find dialysis in unit wherever they go. પેલો હરદ્વાર ફરવા ગયા હોય કે ક્યાંય બીજે મોટી જગ્યાએ, તો ત્યાં એમને સેન્ટર શોધવું જ પડે. એના વગર they cannot travel more than 3 days, કારણ કે નહીં તો પાછું એને પલ્મોનરી એડીમા થઈ જાય, તકલીફ થઈ જાય. It doesn't give quality of life, 100% quality of life. There it is not better in dialysis than in transplant. So they have continuous symptoms. Our dialysis patient, almost every patient has some symptoms. થોડીક વીકનેસ ડાયાલિસિસ પછી બી રહેતી હોય કે નાના મોટા સિમ્ટમ્સ that are always there. While kidney transplant gives a near normal life, they are back on the normal life, they can achieve all the milestones of life. Unmarried people will get married, they will have kids, they have freedom to move and freedom for diet. So question is, why kidney transplant? It is for better quality of life. They have near normal quality of life. They will have freedom of movement, freedom from dialysis, minimum dietary restrictions, normal sexual life. They can have kids, so fertility improves. Those patients who do not have periods after this kidney transplant, successful kidney transplant, they start menstruating, they can become pregnant female patients. Overall cost, if you compare dialysis and transplant in long term, cost of transplant would be lower than the dialysis lifelong. See, this is one of my patients who has gone to Kashmir trip, who is doing this all sports activity after transplant. So that definitely improves after transplant. So this is a retired couple, husband donated to wife was 61 year, and now they are playing happy hours with their grandsons. Their quality of life is quite better. I remember she was on dialysis since 5 years, and her fistulas and everything exhausted, and it was difficult to get dialysis. And then she took the decision કે ટ્રાન્સપ્લાન્ટ કરશું તો એમ કે જીવી ગયા તો નવી લાઈફ મળશે, નહીં તો ડાયાલિસિસ નહીં થાય તો આમાંય મરવાનું છે. અને હસબન્ડ ડિસાઇડેડ વાઇફ નહીં હોય તો મારે જીવીને શું કરવું છે, લેટ મી ગીવ કિડની, અને ઇટ વોઝ સક્સેસફુલ. નાવ દે આર હેપી, ઓલમોસ્ટ 1.5 year completed to transplant. She is doing very well. So now further questions, doctor, are there any danger in kidney transplant? આ બધાના મનમાં હોય કે ભાઈ કિડની ટ્રાન્સપ્લાન્ટ કરીએ તો કેવું એમ. So we have seen the survival, that is better, but they have to take risk of initial this transplant period, because initial period is very crucial. So it is a big surgery, long surgery. Usually this surgery lasts, transplants a 3 to 4 hour surgery, and if you include donor and recipient both, it would be almost 5 hours of surgery. There is always risk of rejection post transplant, because body recognize kidney from other person as foreign and always tries to fight against it. They have to be on lifelong medications. Risk of infection is there, and side effect of medicines. These are the risk that can be managed very well. So he decided to go for kidney transplant. So sahib karavi to laiye, but may I know how it is done, and so when it can be done? I am on dialysis, whether I can go immediately, whether dialysis is needed. So what is kidney transplant? Basically, a kidney is implanted in the right iliac fossa and anastomose to the iliac vessels, and ureter is anastomose to the bladder, that is native bladder. So old kidney is not removed usually. If that is diseased, infected, abdominal cavity does not have that much space to put the new kidney. જે polycystic kidney વાળા હોય એની કિડની બહુ મોટી હોય, around 20 centimeter, 25 centimeter. So they don't have space in the abdomen to put. In that condition, we may have to remove the kidney. So this is how it looks like when we have transplanted. That kidney is anastomosed to the iliac arteries and veins, and the ureter in the bladder, and then original kidneys are there in situ. So this is how kidney looks, pink and turgid immediately after surgery, and basically it is going to be a teamwork. We require a team of nephrologist, urosurgeon, so that is transplant surgeon, anesthesia team, and other medical teams are also required, good nursing care. All these things are required, and it is not a single man's job. When it can be done? Whether it can be done before going for dialysis, yes, it can be done. That is known as preemptive kidney transplant. It can be done after being on dialysis. Once your workup is done, you can go for transplant. So patient can go ahead with transplant after 6 months, after 6 years also. Patient should be medically fit at the time of transplant. Who can offer the kidney? Is family donor compulsory? Can you manage donor for me? These are the questions. આ બધું એમ થોડું રેપો થાય ને પછી આ ક્વેશ્ચન આવે છેલ્લે પેશન્ટનો કે સાહેબ કરી આપશો કિડની કંઈ. So for the donor, he should be adult, so that is more than 18 years. So 55 years was there initially, but now patient should be fit, can be accepted up to 70 years also, provided the donor is healthy and kidney is healthy. If kidney is okay, then only we can take, then it will give results in the patient. Male, female, both can be donor. Sound mind should be there. Patient એવું કહે કે મારો આ ભાઈ છે કે મારી આ છે ફેમિલી મેમ્બર પણ એ મગજથી અસ્થિર છે કિડની લેવાય, we can't take. Because legally they should be of sound mind to give the consent for kidney transplant. So psychiatrist role is also there in kidney transplant. We evaluate all patients psychologically, and psychiatrist sees all donors and recipients, and then they give the fitness, that is psychological fitness. Who can be? Father, mother, brother, sister, wife, husband, grandchildren and grandparents. These are by definition, by law, this is the family. Beyond that, it is not family. It is unrelated, that is cause. So if suppose કે કાકા આપવાનું કહે કે પછી મામી આપવાનું કહે, ફોઈ કહે, so by definition they will be near relative, but they will not be a part of family as a definition of this latest law. And other is unrelated or friend or some other person who is donating. That is altruistic donor. Out of their affection, they are donating. But there should be no exchange of money, no interest of conflict between two parties. Then only it is acceptable. Legal permission is required for that. That you may have to get the clarification from the court of law. Then we can proceed. So these are our patients. Father donated to her daughter, and mother donated to her daughter. These are the two patients who are doing well. So what is the source of kidney transplant? If we see, it is living donor or cadaveric donor. Living donor means a person who is alive, who is worked up in front of our eyes. We investigate, we look for all organs, everything is fine. Then we take the donor and patient both simultaneously in operation theatre. On one side kidney is retrieved, on the other side that recipient is prepared, and then we put the kidney. This is known as the live kidney transplant, and it is much more desirable than this cadaveric transplant because surgery is immediate. Immediately kidney is removed and implanted, so results are better. Other is cadaveric donor, that is deceased donor. Those patients who do not have the family members or other live donor, they will opt for registration for kidney. And once they get the deceased donor, so that is the died person who is on ventilator. So rather than died, we will say dying person. There is brain dead or cardiac death. So now it is majority is brain dead donor only. Cardiac death is recently started. That patient is dying, CPR is going, immediately you take the patient to OT and you retrieve the organs. So that is the donation after cardiac death. But all majority are now at present deceased, there is brain dead donor. So brain dead patients, kidney is retrieved from one center, sent to the center, that is government, then distributed to the hospital respective. That is the cadaveric transplant. Here the transportation of time is important. During that part, kidney would be ischemic. So that kidney does not start functioning immediately. એટલે કેડેવરમાં ઘણીવાર અમારે ટ્રાન્સપ્લાન્ટ કર્યા પછી પણ ડાયાલિસિસની જરૂર પડે કારણ કે યુરિન વિલ ટેક ટાઈમ ટુ રીસ્ટાર્ટ. એટલે પેલું એટીએનનો કમ્પોનન્ટ થોડો ઘણો એમાં બેસી ગયેલો હોય. વી એક્સેપ્ટ up to 24 hours. If it is beyond there, then we do not accept. It is better, earlier kidney is received, it is better. એટલે હોસ્પિટલમાં જ પેશન્ટ બ્રેન ડેડ થાય ને ત્યાં જ ટ્રાન્સપ્લાન્ટ થાય, that would be best situation for the transplant. So then family came forward, father, mother. So all were worked up, that is father, mother were rejected, brother was ready to donate, but blood group was A positive and patient's blood group of B positive, so blood group was not allowing. So he asked what can be done further. So whatever rules applies in blood transfusion, that will apply to kidney transplant also. So O patient will receive only from O, A will receive from A or O, AB is universal acceptance. So what to do further? So family members, it is difficult. So brother blood group is not matching. So when suitable donor is not available, these are the options. Swipe transplant. So that is we have to find a pair of A and B. આ બાજુ A B ની છે, પેલી બાજુ B A ની પેર શોધો અને then you do the surgery simultaneously on same day બે એજન્ટની, એક આને આપે, પેલો ફેમિલી આને આપે. So that is known as swap transplant. Other is ABO incompatible. That is blood group નો જે barrier છે, that is circumvented by plasmapheresis, rituximab and some other treatment protocols. So that can be done, and other is again a cadaveric transplant registry. So that is another option. So these are few of the last slides, I think I'll be completing. So basic three pillars are, once patient is transplanted, they have to be lifelong medications. We have to watch for rejection and we have to prevent infections. So some regular medications they have to take lifelong. There should be no substitution for medicine. We have to prevent rejection. These are the three medications at least they are on. The prednisolone, tacrolimus and MMF. These three they are on lifelong. So rejection is that body starts attacking. So that is rejection. Infection control is very important, lifelong. Post-transplant, they have to be on regular medication, regular checkup, and they have to be on regular consultation so that their graft works longer. Thank you so much for your patience listening. I'll be happy to your answers. In well-matched blood group and HLA, rejections rate with now latest medication, that would be around 10% to 20%. Mic upon. If someone wants to take kidney from, okay, if suppose someone want to donate the kidney, they have to go through the legal process, everything. So their all datas are checked. There's તમારા બધા જે આધાર કાર્ડ, પછી જેટલા બી ગવર્મેન્ટ ડોક્યુમેન્ટ્સ હોય, everything is checked, match, even your pedinama is seen, your family tree is seen, and then they are accepted. They have to take a permission from the government, and after government's approval only transplant is done. So each and every patient's file goes to Gandhinagar. There so ethical committee is there. They will review all the donors and recipients. They will ask them to come for interview. So patient's pair goes there. They take the interview. They see all the documents, and then they give the permission.
Any specific criteria for that, sir? To donate kidney from other person?
See, if it is from the family member, it is quite easy. So you have pedinama, that is your relation is proved. If husband wife is there, so then marriage certificate is mandatory. So if that is there, they will see that this is there. If there is someone is unrelated, suppose someone comes that this is my friend and he wants to donate, then hospitals, treating team and everyone will make sure that there is no even 0.001% chance of unrelated transplant. And for that is many things are there. Many hospitals have there's private detective agency also, who goes to the patient's home. They see whether these are real husband, wife or not, real father and brother, the father and mother are there or not. And many times when a son wants to donate to a father, very young person who wants to donate, so these are the few patients where, or the foreign nationals are there. Okay, these are the cases where you can be in legal issue in future. So we have to make it very, very, very stringent criteria.
Thank you, sir.
Yeah.
Anyone? Okay, thank you, Dr. Anil Patel. We would like to invite Dr. Ramesh Jain on the stage to felicitate him. Yes, thank you very much. This is actually medico-legal process of kidney transplant and donor selection, etc. is a whole one-day job, I think, and now government is really very strict about it. Thank you, Dr. Anil Patel.